diabetes with and without complications. You know, diabetes is an area or a disease process that all coding educators love to talk about because you can teach just about every one of the ICD guidelines using diabetes in one way or another because it affects all of the body systems. But it is also very important to understand because so many people have diabetes and it does affect other complications that people have. Um, Diabetes is really harsh on the body and it breaks down other organs. And so we're going to talk about some of those um, complications with and without for diabetes so that you can have a better understanding and it'll allow you to code to a higher specificity as well as code faster. Really, documentation is extremely important. So if you're working with providers as a coder, these are the things that you're going to be looking for: quality documentation and the specificity on things like type 1 or type 2 diabetes, which are the two most common in the code set, type 2 being the most common, like 98% of all diabetics are type 2. And that's why there's a guideline that says we default to type 2 diabetes if it's not documented. It follows the disease process. But we also need to know, does that patient have complications? Is it with or without complications? And if there is a complication, what body system are we dealing with in the complication? Now, it's good to know that over 60% of diabetics have systemic complications. And in the code set, it allows you to identify the system that has the complication. And we also use the terms controlled and uncontrolled when dealing with diabetes in the code set. So let's talk about some of those complications. 25.2% of our seniors have diabetes. Now, this is due to many factors, but one is that type 2 diabetes can come along with age, especially if it's a family history of diabetes. Now, it's not saying that they're doing anything wrong. It is as far as not being healthy. It's just they have a family history, and as their body ages, they develop diabetes. And then there's other people that get diabetes, and it's due to ethnicity. Hispanics are more predisposed to diabetes than other ethnicities. And that's the same with other diseases and disease process. And how do we know that? Because of the statistics from the code that you've been capturing through the years. It's also important to know that greater than 85% of our seniors with diabetes have manifestations or complications that go along with their diabetes. So not only are they getting older and their bodies and those body systems are aging, but when you have diabetes, that just makes that, I don't want to say the aging process go faster. That's not really the right way to phrase it. It's just that it's another additional strain on those organs and those body systems. The Kennedy Health Evaluation for patients and diabetics, which is called KED, that actually is a HEDIS measure, a quality measure, and a lot of large facilities are going to this process for tracking diabetes, and it's KED, Kidney Health Evaluation. You might want to look it up. It changes some of the metrics, and it also tells these providers what tests need to be done every year for your patients that are diabetics to make sure that you're capturing any complications. So that might be something that you want to have in your knowledge base. So let's talk about HCCs for a minute and the disease of hierarchies in diabetes. We have the HCC of 19, which is diabetes without complications. So that would be an E11.9 or an E10.9. Now there's other diabetes like E08, E13 and stuff. We're not going to talk about those at this point because they there's some nuances about that. But let's just talk about plain old E11.9 type 2 diabetes without complications. That's going to have an HCC of 19. But when you have a patient that has a chronic complication, that HCC changes to an 18. And that would be something like stating that your patient has neuropathy or polyneuropathy. That's a chronic complication. And so, if a patient has an acute complication, that will change that patient's HCC to a 17. And of course, going from a 19 to a 17 is definitely a big change in their RAF score. Now, when you talk about hierarchies, a 17 overrides an 18 and an 18 overrides a 19. And that would be the same as that an 18 would override a 19. Now, don't think that it matters with all of the HCCs that the number is lower and therefore it is a higher hierarchy versus the number being larger. Don't pay attention to that because that's not always the rule with your HCCs. However, with diabetes, you have three that you look at. It's 19, 18, and 17. 19, no complications. 18, a chronic condition, complication, and 17 is something acute, sudden onset that happens with that diabetic. Now, let's think about the codes themselves. If you have diabetes with or without complications, so it doesn't matter, what are the different options that we have for diabetes? Now, we always talk about E11 because that's what most people have. And then we know E10 is type 1. I like to tell students that if you look at E01, remember 1 character is for type 1, and then with E11 has 2 characters or 2 1, so it's type 2. Maybe that'll help you understand it. Any of those little things that can help you memorize those. But there actually are others. So let's start with E08. That is the patient has developed diabetes due to an underlying condition. And then you have E09, which is the patient has diabetes due to a drug or chemically induced condition. So they've been given a medication that has turned the body into having diabetes. These are often temporary, E08, E09. And then jump over to E13. It's a very specified type of diabetes. It's other. And the code set will define other as, hey, we have specificity. We know what it is. There's just not a code for it at this time. And so some of there's specific options in there. I don't think you're probably going to see that being used as often, but there is reasons to use it. I'm thinking maybe you could use that for a LADA patient, where it's a type 1.5 diabetes, where your patient starts out as a type 2 diabetic, but within so many years, their body changes to a type 1 diabetic, which is not done. You're born with type 1 diabetes, and therefore this is something unique that they started studying in the 80s. It's quite fascinating. You might want to go look into that, called LADA, LADA. Now, the fourth character for diabetes, when we look at E08, you're going to have a fourth character of, you could have 2, which is kidney complications. Now, so your patient could have, CKD or some other renal complication, and they would be an E08.2. Or if they have neurological complications, it would be a 4, E08.4. Polyneuropathy has developed. And if you have an E08.5, that's with circulatory complications, maybe hypertension. That could be used in E08.5. So with E08 and the patient has complications, you have 3 choices. You have kidney, neurological, or circulatory complications. Now, E10 and E11, they have multiple, but with E08, 3 choices. the fourth character by body system. If we look at E11, again, we're just going to pick type 2, and we want to know what that fourth character stands for, then we're going to have this little chart. Now, you can try to come up with a way to remember these, but I haven't come up with something particularly easy. You may just have to memorize which one's which. So with O, which isn't used very often that I have patients that I'm familiar with, hypersomnolarity. One is ketoacidosis. Now, ketoacidosis often happens with your type 2, or excuse me, diabetics that are type 1. The body trips into ketoacidosis. It's not as common with type 2, but it can happen. So your main ones, though, that you're going to see with your patients is 2 for kidneys. I guess you could remember that is that we have 2 kidneys. 1, 2, left, right. 2 for kidneys. 3, ophthalmic. How are you going to remember that 3 is ophthalmic? Well, we have 2 eyes, but some people have a third eye, they say, right? That's what they like to make sci-fi movies out of. So maybe that would help you remember that. 4 is neurological. Well, when a person has polyneuropathy, they have pain in their extremities, and we have 4 extremities. We have 2 hands and 2 feet, and that's where the pain happens. So maybe neurological, you could think polyneuropathy, which is one of the most common complications that happens with diabetes overall, that polyneuropathy. So hopefully that's helping. 5 is for circulatory. Now, I don't know how you could remember that. 5, there's not anything that just pops into my head. However, I do know that you have 4 chambers of the heart, right? And um, so if you had 5, think to yourself, what would happen if we had 5 chambers of the heart? I don't know. We would have maybe it would make our heart weaker or stronger. But if we had 5 chambers, that would affect the circulatory system. Yeah, again, any way that you can come up with to think about it. If you have something, let us know. That would be fun to figure out how you would, or maybe you can list 5 major vessels. 6 is other specified. And again, other means we have a definition, we just don't have a code for it. And then 8 is for unspecified. Again, not used as much. With all of these again, if you want to be faster, if you memorize these, what that 4th character stands for, it will help you with testing. It'll make you faster in picking your codes, and it will make you more savvy at getting to the higher specificity, knowing that these are available to you. There's some other codes that you should be aware of. One is long-term use codes for insulin, Z79.4. If a patient's put on insulin, often they don't get taken off insulin unless they've got a particularly different type of diabetes that would be gestational diabetes, which is actually an O code, not an E code. But gestational diabetes, a person could actually go on insulin and go off insulin once the baby was born. But again, once a person's put on insulin, they're pretty much stuck on insulin. And then there's also a code Z79.84 for long-term use of oral and anti-diabetic drugs. And there's a list of different drugs that patients are put on for diabetes. And it would be a good idea to go look some of those up so that you would have a better understanding of when you see things like that, like metformin. Z79.84, excuse me, I said that wrong, Z79.899. This is long-term use of drug therapy. Now, this is a very broad code, and it's in a different color so that you can separate it and know that it's not only applicable for a diabetic medication, but it's applicable to that same term. We got a drug, the patient's on long-term use of this drug. However, there isn't a specific code for it. So this is the code we're going to use, because there is actually another code for other medications like Coumadin and Warfarin, long-term anti-platelet medications. But if a patient's on Trulicity or Victoza, then that is one that uh, needs to be accounted for, and that would be a Z7 9.899, because your providers are having to manage that. It's part of their medical decision making, and we want to make sure that that's captured. Now, if you talk about HCCs, this one doesn't carry an HCC. However, it does show a thread, that golden thread for meat. Now, a better understanding of some of these others that we don't talk about as much would be diabetes due to underlying conditions. That's that E08. If a patient has neuropathy, that would be 2-1. And if a patient has, or, excuse me, not neuropathy, nephropathy, that is something that you got to pay attention to. Don't make this mistake I just did, nephropathy versus neuropathy. And then we have CKD. Patient with CKD would be a 0.22. If they have other diabetic kidney complications or renal complications, that would be a 2.9. Now, other, like I've said before, is defined as the code set has not set up a code for it at this time, but you do have specificity written by your provider. What about E09, drug or chemically induced diabetes? What are our options? Well, it would be a 0.51 if you had your patient that's diabetic with peripheral angiopathy without gangrene. And then you have a 0.52 with gangrene, peripheral angiopathy with gangrene. Now, remember, the reason these are very specific is because it's drug induced or chemical induced, and these are complications that happen to those patients, or there wouldn't be a code like that. 0.59 is other circulatory complications. Note, if it's applicable to code for poisoning due to drug or toxins and adverse effects, because that's another code that's available to you that's related to drug or chemical induced. E13. Well, again, this is not one that I see as often, but other specified diabetes. If you have other specified diabetes with nephropathy, unspecified, that'd be a 0.40. You could have 0.41 for mononeuropathy and 0.42 with polyneuropathy. And then there's 0.434 with autonomic polyneuropathy. Now, if you don't know the difference between mono and polyneuropathy and autonomic polyneuropathy, it would be a good idea to go look those up. If you understand sources, root words, and prefixes and suffixes, you can pretty well make that out. Is that mono means one, poly means multiple, autonomic, auto means from yourself. And then there's another 1.44 amyotrophy, and then 0.45 is other neural complications. In other words, we don't have a code for it yet. Now let's really break down CKD and diabetes, because it is very common. The diabetes is harsh on the kidneys, and one of the first things that tends to go in the documentation that I read is the patient has a neurological complication like neuropathy. And then second most common in the ones that I see is some type of kidney complication. There is 0.21 with nephropathy, and then 0.22 with CKD, and 0.29 offers for other kidney complications. Now, whenever you use the E11.22, that 22 says, hey, by the way, we have to stage this DKD. So that means you're going to pick an N18 code through 0.1 through 6. So stage 1 is 1, 2 is 2, 3 has 2 codes available, N18.3A and 0.3B. If you 4 is very common also, but when you get into 5, that is severe CKD, and that patient is getting really close to needing to be on dialysis. If it's a 0.6, that means they've gotten to the stage where they need dialysis. This is end-stage renal disease. And if that's the case, then you also are going to use the code Z99.2, dependence on renal dialysis. Now, you could have a patient that has diabetes, has kidney complications, and they've had a kidney transplant. Just because that patient has a kidney transplant doesn't mean that they're miraculously cured from CKD. They may have gone from an N18.6 CKD end-stage renal disease to an N18.2. So the kidneys are still struggling. They're just not at the level of failure like they were before. And it's really interesting to note that they don't take out kidneys if you have kidney failure. If they're going to give you another kidney, they just make a little pocket inside you and route the new kidney in. So you could have 3 kidneys or 4 kidneys by the time you get done having multiple transplants. It's kind of interesting. Unless the kidney is diseased, like with cancer or something, they do actually take those out. So if you use stage 5, and that would be, you can reference the labs. The GFR is one of the labs that's noted for checking kidneys, and you get into that kidney failure, but you don't have dialysis started, then again, you are at stage 5. But once you get into stage 6, that means that you've been put on dialysis. Ophthalmic complications is probably the 3rd most common thing that I see in the documentation for patients. And it's a 3, maybe another way to remember it, because again, that's an organ system that's very delicate. The vessels behind the eye, extremely delicate. And whenever you have high blood sugars over a long period of time, or you go up and down in your blood sugars, it just terrorizes the eye, so that you can have a lot of eye complications. So A1 is going to be unspecified diabetic retinopathy. And then 2 is mild non-prolific diabetic retinopathy. Now, if you don't know what these mean, I would take some time to go look them up. 3 is moderate, the same non-proliferative retinopathy. 4 is severe. And then 5 is proliferative. All the others are non. So this is proliferative diabetic retinopathy. And then you get into 6, which is diabetic cataracts. And again, I like to think of it as, when you drive a car for a very long time, it's starting to get older and your headlights are all scratched up and they aren't as bright as they used to be. That's kind of what a cataract is like. That eye gets scratched up. And when you have lots of sugar in your system, it just kind of scratches up those lenses. That's how I remember it. So a 6 is cataracts. 7 is macular edema, but you can also code for resolve following treatment. And then 9 is other diabetic ophthalmic complication that's not listed in the above. So with this code set being set up the way it is, we know retinopathy is very common with our diabetics. We have non-proliferative, proliferative, we have cataracts, we have macular edema, and anything else would be an E11.39. That 6th character, when you get to it, it's going to show higher specificity, and in the description where you see those dashes, meaning there's more characters that are needed to tell the story. But that last character usually determines laterality, because you have a code for left eye, right eye, bilateral, both eyes at the same time. Neurological complications, that's the one that ends up, kind of being the number one thing I see in my experience. And remember, neurological is the nervous system. Not just the brain itself at the central nervous system, it's the peripheral nervous system. So that 5th character is going to be an O, would be just neuropathy unspecified. 1 is mononeuropathy, 2 is polyneuropathy, 3 is autonomic polyneuropathy, 4 is amyotrophic and 9 is other neurological complications. Now, if you wanted to know about autonomic neuropathy, I went ahead and put this in there just to give you some information about what can happen as far as autonomic neuropathy symptoms. It can affect the heart, the bladder, the bowel, difficulty in your digestive system, sexual dysfunction, visual problems, as well as regulating body temperature. Now, all of these, if you're into risk adjustment, can be used as meat for any of those neurological complications. So you can use that as a line if the patient's having, problems regulating their body temperature. The provider gave the diagnosis of E11.44 as, excuse me, no, that's not it. It's 0.43 autonomic. Then again, that's that thread. Then documentation can be used as meat for risk adjustment. And I think that's it. All right. So that was a really exciting stuff. I, again, always urge you to, if you are not familiar with any of these terms that we talked about, make sure that you take some time to go look them up to increase your knowledge base. It's going to make you a better coder. It'll allow you to be faster and get to a higher specificity, and it's just fun doing the research. All right. Thanks, guys.
Do you need more medical certification and business training? Learn more at www.cco.us.